we have to migrate from this notion of a point-to-point care coordination into a more, how do we empower an ecosystem of care?
Yep.
And in doing that, how can we enable a symbiotic relationship where it doesn't have to be a zero-sum game? Everyone can win with the process, ultimately with the focus on the patient.
When we first started, we really focused on the patient outcome that we wanted. And as people in healthcare, that's what a lot of us do. One of the things that we realized is that we had to focus on the ecosystem as well and think about what the component parts were that had to be in place to get those client outcomes.
Have you ever in this journey seen any kind of resistance from patients, or do they see the advantage? Do they see the betterment in their quality of life and whatnot?
We were able to see that it was much harder for us to engage people with a serious mental illness, much harder for us to engage people with a history, with an arrest record. We have actually built new programs with our partners because of that.
We did a study on about 1.4 million patients. There was 1/3 Medicare, 1/3 Medicaid, 1/3 commercial. And we looked at an entire year's worth of data. There were less than 1.3% of patients that were identified to have a social determinant impacting their care, which both of us know that's not true. We're not doing enough to address that need. How do you see tech and data playing a role as we take this forward and try to address more inequities across the country?
I think what we do well, we really match up the sort of tech side with the where do you need warm help side. One of the things that we are a little bit like obsessive compulsive about is the data that we have right now today that represents a person that we can help right now today.
Tech and data, when it comes together, when it meshes in the right way, I think it empowers the human aspect of care, and which is key for Camden to survive, which is key for this idea around value-based care driving better health outcomes in the community.